Hello, this is Rick Reardon. In this video lecture, we're going to be introducing you to Chapter 1 and getting you started on the history of medicine and the history of health information management. Okay, and I'll let you read the objectives on your own, but we'll start with the introduction. Healthcare delivery is getting increasingly more expensive, and a lot of this is fueled by technology. Years ago, in fact, probably fewer than 100 years ago, hospitals were mostly places where people went to rest, recuperate, and perhaps have a broken bone set or another simple procedure. Now we have MRIs, we have scopes, we have all this different technology. And of course, with technology comes a cost. So again, throughout the history of medicine, we're seeing things go from more of a religious, spiritual types of things. And as we get through modern times, it goes from being more of a spiritual venture to being more based on technology. We had several discoveries that impacted medicine. These include pasteurization, germ theories, Lister, all these things that impacted medicine dramatically and still impact it today as with COVID-19. So we have a lot of things in terms of infectious disease that are still issues with us to present day. And of course, we had Fleming, who discovered a revolutionary germ killing power of a mold, which resulted in penicillin. And immunizations, AIDS, robotic surgery, and many, many others. So a lot of these things are still with us. And before we move on, think about three important discoveries that impact medicine and why you think they're important. Now we're going to get into healthcare delivery in the United States. Healthcare delivery began with, as we talked about, basically kind of almost folk medicine, kind of like if you've ever seen the movie Paint Your Wagon, where we have this kind of snake oil salesman who promised all different types of cures. And again, as we got more industrialized and technology became more of a big thing, we had hospitals and evolving to our present day state here in the 21st century. Here are some landmark dates that you should be familiar with. 1751 being the Pennsylvania Hospital founded by Benjamin Franklin, first hospital in the US, the founding of the AMA in 1847, the National Medical Association for African American Physicians and Health Professionals in 1895, and the American Hospital Association predecessor, the Association of Hospital Superintendents, being founded in 1898. We continue on. 1965 was a big year. We had changes to the Social Security Act, which created Medicare and Medicaid. These are two programs that serve the elderly and the medically indigent. And then we had in 1982 the TRFA, Fiscal Responsibility Act, which kind of led to the forming of diagnosis related groups, which we'll hear more about. And then in 1986, the Federal Healthcare Quality Improvement Act established the National Practitioner Data Bank, which is a nationwide database about physician and other practitioner credentials, including previous medical malpractice payment, license lifting, and what have you. In 2001, what was formerly known as the Healthcare Financing Administration changed its name, as federal offices often do, and became the Centers for Medicare and Medicaid Services, otherwise known as CMS. The following year, CMS changed the names for peer review organizations. Now are known as quality improvement organizations that review medical records for quality control, utilization review, and medical necessity. Then 2003, we had the Medicare Prescription Drug Improvement and Modernization Act, which provided Medicare recipients with prescription drug savings. Now, we talk about the continuum of care, and I'm going to end it right here, which basically talks about the different types of healthcare. The continuum of care basically matches an individual's health needs with a level of care on a continuum. And this could be primary, secondary, or tertiary. And that's all I have for you. Come back for our next video lecture. We'll be talking more about Chapter 1. Bye now.